Dear students, welcome back. In the previous session we have discussed about subtalar axis and also subtalar neutral, and what are the movements taking place in the subtalar axis. So normally at the subtalar joint it is having only 1 degree of freedom, which causes motions called supination and pronation, that is called subtalar motion, which is taking place on the subtalar axis. So as we know, the subtalar axis, how the axis, based upon the axis, so this movement, that supination and pronation which is taking place, is not as an individual movement, because it cuts all the axes. So combination of movements are going to taking place. So that means supination and pronation or the composite motions are present in these two motions. That means a combination of movements are going to take place during supination and pronation, and these motions cannot be separated in the subtalar joint movements. So all these combine together to form supination as well as pronation. Okay, now we are going to discuss about the subtalar motions in various ways. One is non-weight bearing as well as weight bearing, and also what is the effect of weight bearing subtalar joint motion on the lower leg. Okay, so now we will see in non-weight bearing a subtalar joint motion. In non-weight bearing supination and pronation, subtalar motion is described by the motion of its distal segment. What is the distal segment of subtalar joint? Calcaneum. Yes, good. So on the stationary talus and lower leg. Okay, so the movement is described as it is the motion, the subtalar motion is described by motion of its distal segment, that is calcaneum, on the stationary talus and the lower leg. Okay, where the reference point on the calcaneus is its anteriorly located head. Okay, so what is going to be happening, what is the composite motions we can observe in non-weight bearing supination as well as pronation. Now first we are going to see the supination movement, which we can observe in the B pic. Okay, in non-weight bearing supination is composed of coupled calcaneal motions. Here the calcaneal motions are coupled, that means it includes 3 movements causes the supination. So what are the coupled calcaneal motions which causes adduction? So the calcaneum causes adduction as well as inversion. So adduction, you can see the foot how it is adducted, inverted, and also it causes plantar flexion. So plantar flexion. So because of this plantar flexion only we can find this plantar surface of the foot. So these are the combination of movements taking place in the supination in non-weight bearing. Okay. Okay. So now we will see the another movement called pronation of the non-weight bearing calcaneus on the fixed talus and lower leg is composed of again the coupled motions of calcaneum, which causes, you can see the abduction. So abduction. Okay, the calcaneum also it is going to abducted here, and then which causes eversion. So this part is everted, and then dorsiflexion. So dorsiflexion is taking place. So for that reason we can't see the plantar surface here. Okay, and if you observe the angle also, so here, which is that means the calcaneum, the medial side angle is increased in the pronation. That is normally we have already observed when the person is standing, okay, that in that previous discussion, that is calcaneo valgus, and here we can see calcaneo varus. Okay, so these are the things which are going to happen in the non-weight bearing subtalar joint movements. Okay, yes, so these are the things. Now we will move on to the weight bearing subtalar joint movements. Yes, here we can find weight bearing subtalar joint movements. Okay, what is going to happen in this thing? We will see now. So when an individual is in weight bearing, what is going to happen now? Okay. Yes. Now we can see this thing. When the foot is in non-weight bearing, the motion across the subtalar joint is accomplished by the distal calcaneal segment, isn't it? So when the calcaneus is on the ground and it is weight bearing, now what is going to happen? So it is not free to accomplish each of the component motions, isn't it? But still the calcaneus can still evert and invert, that is valgus and varus motions we can see, although this will result in some side to side movements, some side to side motion of the foot on the ground. Okay, however the calcaneus cannot dorsiflex or plantar flex or abduct and adduct while weight bearing, since the superimposed body weight, so because of this body weight which effectively prevents these movements. So since subtalar motion cannot consist of inversion, eversion in isolation, the other two components of the subtalar motion, that is, which are accomplished by the proximal talar segment rather than by the distal calcaneal segment. Here in the non-weight bearing, we have observed that the movements which are causing in the distal segment, isn't it? Here also in weight bearing, it shows some movements which causes still eversion and inversion, which causes valgus and varus motions, which results in side to side motion of the foot on the ground. But the calcaneus will not dorsiflex and plantar flex or abduction and adduction. But still the movements in the weight bearing, which is mainly caused by the talus, not by the calcaneum. This is very, very important. You have to keep it in mind. That means in weight bearing, what are the things are going to happen? Only calcaneal inversion and eversion. The remaining abduction or adduction, dorsiflexion and plantar flexion like this one is carried out by the talus, not the calcaneum. So this is very, very important thing. You have to keep it in mind. Okay. Now, the motion accomplished at a joint remains unchanged when the distal segment of the joint moves or whether the proximal segment moves. Okay, when switching segments, however, the direction of movement of the new segment reverses to accomplish the same joint motion. Okay, so here if you see in the weight bearing subtalar motion, the direction of movement which are described for the calcaneum in supination, pronation is going to reverse now, when the motion is accomplished by the talus. So we have seen the sequence of motions which occur in supination and pronation, isn't it? So except calcaneal inversion and eversion during supination and pronation, the remaining motions of the subtalar joint in weight bearing are going to be reversed now. Okay, yes, now that thing we are going to see now. Okay, so the subtalar supination that consists in non-weight bearing of adduction and plantar flexion of the calcaneum is in weight bearing is accomplished by abduction and dorsiflexion of the talus. Abduction and dorsiflexion of the talus here, which is going to dorsiflex like this, and abduction is taking place in the supination. Whereas in the weight bearing subtalar supination therefore is accomplished by the component movements of inversion of the calcaneum, and dorsiflexion and abduction of the talus is going to take place. Now coming to the weight bearing subtalar pronation. So what are the normal sequence of the pronation in non-weight bearing? That is calcaneal eversion, calcaneal abduction, calcaneal dorsiflexion. Now in weight bearing, what is the thing going to happen? Only calcaneal eversion. Okay, and the remaining movements are changed by talus. That too reverse of the calcaneal movements. That means calcaneal abduction in non-weight bearing. Now here what is going to taking place? Talar adduction is going to taking place. Okay, so talar abduction is going to taking place in the case of pronation, that is talus adduction. Okay, and then the component motions of abduction and adduction of the talus occur around a vertical axis, and sometimes this is referred to as lateral rotation and medial rotation is of the talus is going to take place. Here talar plantar flexion is going to taking place in the case of supination. Okay, so here we can see here the abduction of the head of the talus. So here the abduction of the head of the talus is taking place. That means the body of the talus is going to rotate laterally. Okay, so which is taking place under the tibiofibular mortis, so that we have seen in the ankle joint. Okay, this is the thing which is going to taking place in weight bearing subtalar joint motions. Okay, so with this weight bearing subtalar joint movements, what are the things which affects on the leg we are going to see now. So we will move on to this thing. Yes, this is the weight bearing subtalar joint motion and its effects on the leg. Okay, so if you see, this part is leg and this one is the subtalar ankle joint and the subtalar joint motions here. Okay, now a medial rotation of the weight bearing leg. So here this is the medial rotation of the weight bearing leg imposes pronation on the distally located subtalar joint. So which causes pronation? Which causes pronation of the distally located subtalar joint. So pronation means what are the movements which are taking place in the pronation during weight bearing, you can analyze here. And in this B picture, so there is a lateral rotation of the leg proximally imposes supination on the distally located subtalar joint. So what is going to happen in the supination, okay, on the distally located subtalar joint? The same thing we have discussed on weight bearing, you can implement here. So this is the thing which is going to happen on the leg. That means here simple thing. So the pronation in the weight bearing of the foot, which causes medial rotation of the leg, and supination on the distally located subtalar joint causes lateral rotation of the leg proximally. So these are the effects of subtalar joint motion which causes a rotation of the leg. So these are all the subtalar joint function during non-weight bearing, weight bearing, and now we will see the range of motion of the subtalar joint now. Yes, here we will move on to the subtalar joint range of motion. So the range of subtalar supination and pronation are difficult to assess because of triplanar nature and because they vary with the inclination of the subtalar axis. The calcaneal component of subtalar motion, however, is relatively easy to measure in both weight bearing and non-weight bearing movements, as the angle of varus or valgus of the calcaneum with respect to the tibia. So by this like this way we can calculate the range of motion. Again we will move on to this non-weight bearing. So here you can find this thing. So because the movements of this calcaneum with that of the leg, we can find the range of motion here. So the available range of the component of eversion, that is valgus of the calcaneum, has been measured as 10 degrees, okay, and whereas inversion is 20 degrees for a total range of 30 degrees. Okay, the tibial rotation during the weight bearing position of gait has been measured as, here you have to remember this word, that is tibial rotation during weight bearing position of gait has been measured as 10 degrees. This is for tibial rotation. This 10-degree range would also represent the amount of abduction, adduction of the talus, and which is equivalent to range of calcaneal eversion, inversion measured during gait. The simple ranges, the equivalence ranges of the subtalar ranges of eversion, inversion and abduction, adduction is in the agreement with 4:1 contribution of eversion and inversion. Okay, 4 degrees of eversion and inversion, and again 4 degrees of abduction and adduction, and 1 degree of dorsiflexion and plantar flexion. Okay, so this one we can, because of the axis which is crossed on the subtalar joint, by itself it is indicating that there is a decreased value of dorsiflexion and plantar flexion, whereas eversion and inversion and abduction and adduction are almost equal. Okay, this is the ratio of this eversion, inversion, abduction, adduction and dorsiflexion, plantar flexion are projected by for an average subtalar joint axis. So that means for every 4 degree of calcaneal eversion, one should see 4 degrees of adduction of the talus and 1 degree of plantar flexion of the talus. Okay, so this is about the range of motion of the subtalar joints. So when we see the adduction of the talus, that means we are seeing this movement in weight bearing. So when you will get this talar movement, then it definitely is brought about in weight bearing. If talus is not having any movement, then the movements are taking place in non-weight bearing. These two things you have to keep it in mind. So this is all about the subtalar joint function. So in the next session we are going to discuss about other important joint which is present in the ankle foot complex is talocalcaneonavicular joint. Thank you.